What about the movie Concussion? What about playing football? Will Smith and company from the movie.
You want to fold up the National Football League?
I want to solve the problem.
Who are you?
What do you ask?
You're a pathologist. You perform autopsies.
Yes, I'm a mere pathologist. That's it. That's all I am.
Will Smith, dramatic role in the movie Concussion. Happy to have back on our show the learned one, a specialist on concussions, Dr. Chad Stevens. How are you, my friend?
I'm doing great. Thank you for having me on your show this morning.
Well, I really like having you on. You're wonderfully candid, honest.
Thank you.
Well, man, I mean, everybody understands the $12 billion business of the NFL, right?
Yes, sir.
And everybody understands that around Champaign-Urbana, we have more kids on some soccer teams than football teams. Is it evolving to where we're not going to have enough players because the education's out there?
You know, I don't know. I'm really glad you started out your show with the concussion movie quote with Will Smith. I thought that was really well done and brought a lot of positive awareness to the situation. But there is definitely a decline in, sign-ups in Pop Warner football. And at, some different sports where patients or parents actually feel that there is a risk of a head injury. And so I think that, we can always take the stance of kind of putting our kids into a bubble or burying our head in the sand and pretending things don't exist. But, I see as many concussions in a weekly basis from girls soccer and cheerleading as I do from football and other contact sports. And so I think it's a matter of assessing what your child's skill set and interest level is and how interested they are in contact sports and deciding as a family what the best approach is going to be for your athlete.
Chad, one of the things that I think has evolved, and maybe I'm wrong, maybe perceptually I'm just wrong on this, but when I played some high school football and I looked at a helmet recently, I said, this isn't what I wore. I mean, there wasn't this kind of padding and support. But, back then, maybe it was still happening, the number of concussions, and it just went unreported, or has physics with the bigger, stronger, faster human body taken over from the standpoint of it's just a matter of speed, thus we're having more injuries?
That's a great question. And there's no doubt that through, I'm going to assume that back when you were playing, there was less heavy weight training and emphasis on extreme, muscle strength and speed. And kids these days, let's face it, they're either training for their school or they're training at performance enhancement, facilities,
right.
And they're doing all kinds of things to give themselves a competitive edge. And so I do think there's an element of increased speed of the game and strength in the game. But back in the day, there were still a lot of head injuries that occurred. It was just not really understood as well, I don't think. And people went back in the game, and played, whereas now, at least in Texas, they have a one-and-done rule. If I deem that a player or the trainer deems that a player has suffered a concussion, then you take their helmet away and they're done for the night.
Yeah.
And that wasn't that way many years ago.
No, not at all. Not
we
at
would
all.
wait until somebody declined a little bit, and looked neurologically declining before we removed them. And so there's definitely a rapid removal from a sport now that there wasn't then.
I remember a long time ago, I had a college roommate that played football, and he went on to play in an old defunct league called the USFL, and he was playing. I remember Jim Kelly was his quarterback before he went to Buffalo, and it was this an ABC television game, and he caught a pass, and he got clobbered. He went to the sideline, and the camera was still on him, and I don't think he knew what week he was in. He was just screaming for smelling salt. He wanted smelling salt to kind of revive whatever smelling salt does to the brain, but I'm sure he was concussed, and he just went back in.
Yes, I think there's a certain amount of that happens. I think of Julian Edelman, when we played for the Patriots,
right.
And there was clearly sometimes I thought he looked concussed returning to the game. But it's a clinical diagnosis, and if a player doesn't present for evaluation to their trainer or their coach, some of these can go unnoticed. Now, granted, there's a lot of intense scrutiny of the way doctors and and trainers are watching these players and trying to, remove anyone from the game that doesn't look safe. But football is a fast-moving game, as are a lot of sports, and so it's hard to have your eye on every person all the time. So there is a certain element of players having to be forthcoming with their symptoms.
Right. Well, okay, so, Chad, you say it's safe, relatively speaking. How about the future of the game? Are we going to continue this thing going on, or are we going to run out of players in 30 years?
I've seen some different videos of, like, what the NFL is going to look like in 2020, and the protective gear is different. It looks like there's a lot more Kevlar, involved in the body armor and the helmet inserts and things. But I really think the thing that is going to be the most important is people understanding that they can get resolution of their concussion symptoms somehow. Because what I think the fear that drives a lot of people is seeing a person or two in their life that have had several concussions, and now they can't, do day-to-day activities as readily, and can't calculate things as fast, and are maybe a little slower in their thinking and things of that nature. But what is important is getting rid of their symptoms before they become a chronic problem. And so that's what my real area of emphasis has been over the last few years, is trying to develop ways to, not the smelling salts necessarily, to be honest with you, but this procedure we're doing to get the sphenopalatine ganglion, the nerve complex that's involved in migraine headache, behind the nose, treated early on to get rid of the headache and dizziness symptoms and things of that nature, I think are going to be more comforting and more, when people become more aware that there's options for treatment to help them get back into their life a little faster, not even necessarily back in the game or the sport, but back to feeling like themselves, I think they'll be less afraid to get into contact sports.
Chad, always a pleasure. Thanks for your time.
No, thank you so much for having me on your show this morning.
Anytime. Specialist on concussions, Dr. Chad Stevens is his name. Yeah, Will Smith was the star in the movie Concussion.